If you actually go to the last page of this will sum up the major change with the prescription drug. Currently, right now, retirees have a $0 copay for generic, a $20 for brand, and a $40 for non-formulary medication. If they do mail order stateside, it's 2 copays for a 90-day supply. And there's actually penalty copays in place, I understand, if that medication is available through Canada and they choose not to go through Canada. And then they also have the option to go to Canada for no copay. So with the Medicare Advantage plan, the closest they could get was a $10 copay for generic drugs, $20 for brand, and $40 for non-formulary, and 2 copays at a 90-day supply. The option to Canada would no longer be there, again, as we discussed before, because Empire is assuming when you pay that premium, you're pushing all the medications their way. And if you continued with the CanRx program, you'd be paying on top of already what you're paying Medicare, so it would just cost the county more money.
Okay, I think Rich, you got a question?
Just to let you know, we're in the 80 percentile in that area for retirees going to Canada Rx. So now we're thinking, if the city has a lesser, for some reason, lesser, we have a lot of people going to Canada Rx with zero copay for prescription drugs. I mean, maintenance drugs.
Currently, right now, with both plans, any of your, and I put this down below, but any preventive care, your wellness visits, screenings, that's covered at 100% with the current plan and with the Medicare Advantage plan. So those WellCare visits, those office visits, don't take a copay. Now, Rich, I know you had mentioned before that sometimes the 20% that Medicare does not pay on behalf of the retirees right now is less than the applicable $25 copay. So in some scenarios, they actually don't have a $25 copay. They may have a $20 copay. They may have a $5 copay. They may have a $1 copay. But the reason why we use the $25 copay plan is because I was told by Empire that the $25 copay for sick visits does apply. Not in every case, but it does apply.
Right. But under this plan, we get $25 every time.
Yes, it's $25 every time.
For sick visits.
Just for sick visits, for your welfare.
Screenings and preventive care under both plans, they waive the copay.
Right.
Anyone have questions? Butch?
After this complete analysis and everything that everybody did, thank you very much. This was very educational. Okay, what would you recommend? I mean, you guys are the experts, weren't you? I mean, I'm not. Okay, I'll speak for myself. Okay, I mean, all I look at is the bottom line. The bottom line, if I could save $500,000 in this day and age, I'm going to save $500,000. But what do you, I mean, looking at what we have, what it's costing us, and what we have a potential of getting, what would be your recommendation?
Let me take a step back. I'll answer the question, but fundamentally, the county is in the position to achieve these savings because right now, on one of the pages in Darren's exhibit, your actual cost for the last 12 months for your Medicare population is $444 per belly button per month. Empire is quoting a zero copay PPO for $297 a month. How can they do that? They can do it because the government is subsidizing Medicare Advantage plans. Yes, the subsidy is over time going to be reduced, but it is never going to go away. Basically, what the government is in the process of doing is reducing the subsidy so that the subsidy they pay to the insurance companies to offer these products is equal to what they pay under A and B. There's somewhere between $375,000 and $525,000 on the table that it's going to stay there or you don't take it. It's money that the county could use There are some benefit issues, there are some communication challenges, but in this day and age, even if the net to the county is $375,000, our recommendation is to take it. There are some little bumps, not bumps in the road, but there are some challenges to get this up and running. But the opportunity to save that much money in a calendar year.
Well, the thing is that, I mean, I'm looking at it in two different ways. I hate to see, and I know Amsterdam tried this before, the city, okay, they increase costs to the people that are retirees and are living on a fixed income. I don't want to hurt the senior citizens. I don't want them to have to go and scrape. But if they're saving money annually, okay, and it's not hurting them, which looks like the premium or their cost is lower. Is that correct?
Their cost is low, their monthly premium bill that they would pay to the county would be lower.
It's going to be
Those
lower.
people that pay. You know, each person's going to be different. You know, if you have some Medicare people that are on a lot of drugs, then, you know, that might outweigh their savings there. If you have some Medicare people, which you do, that don't take any drugs, then they're actually getting a lower cost to them. So it's different for each person. There's not, you know.
But the retirees and those that are,
Their bill would be less each month that they pay to the county. That is a known fact.
okay, thank you.
You're welcome.
Okay, I got Bill first.
Just a question, and any one of you can answer this. If we were to go with the Medicare Advantage program with the zero office visit and the no credit, is that not a good thing for both parties? Isn't that the best deal that you have in front of us that we could offer the seniors?
The
The best deal between everything you laid out for us?
The zero.
The zero office visit
Yeah.
Zero with the credit would be the best.
with the credit,
For
which
that
takes
would-
away the additional
But that takes
savings
away
for
money
the
for the
county.
county.
Yes, it does.
Right.
But on balance, would still be north of 350.
Would the premium savings offset the zero credit thing?
The
In the course of a year?
The premium is going, if you take the 25, or the zero versus the 25, it was like it's a $95,000 difference, right?
Right.
So, I mean, what you could do is you could do the 25 and then reimburse people to see if you're, you know, if you're spending the $95,000. You know what I mean?
I think, I don't know, for both, when I was saying, what does it actually cost, that $100 credit to the seniors in the course of a year, if we were to take it away?
On the last page there,
And would that be offset by their savings and their monthly premium?
if you don't give them the credit, okay, then their cost goes up $25 a month for the employee. Okay? They still save money each month, but it goes up $25 a month for the employee. They're still in net savings. So
25% of the 100.
Right. You don't have to give the $100 back, they'll still save money.
correct. That's what the bottom, on the last lines on page 8 show.
Right.
Okay? They still save $16.65 a month and for an employee and $33.31 a month for a spouse, and that's with the $0 plan and not giving them the
So-
credit.
Go ahead.
Okay, no,
So they're gonna save $100 a month, okay? And if they had a copay or whatever for 25, that means they would have to go to the doctor 4 times a month
Yes.
to,
Correct.
so they're not getting hurt.
Well, and then we need to discuss the prescription as well. I mean, that's
Pardon?
it.
Well, even that money would take up for the drug, well, some of it anyway.
Copay for the drug.
Yeah,
Yeah,
the copays.
the copay,
Yeah, they're
right.
paying copays.
That's right, it would pay the copay. So it's a win-win without, okay.
okay, so now wait, so we're at zero copay with the reimbursement, is that where?
Oh, I was just pointing out, I'm not suggesting.
No, I'm just
Trying to find the
wondering
best
what.
deal for the senior.
I just
The
want-
best deal for the senior would be the zero and the
Right.
reimbursement, right?
That's the best thing,
For the
for the
medical,
retired, for them.
for that,
However, if we gave them 0
yes,
and didn't give them the $100,
correct,
they're still saving money.
Yes.
And the county is saving money.
yes, you're right.
Thank you.
Okay, I got Rich now.
But this thing, which is said, on that savings, if you do the on page, the last page, page 8? Is that 8 or 9? The last page, on the bottom, where they're saving $16.65, that goes back to the 810.063 amount, which is not, you're not starting out with 503,000, you're starting out with 409,000. So the savings is not 350,000 for the county, the savings is around 200-some thousand.
Well, the county would be saving the 70,000 that they wouldn't be paying those people.
Right.
So you
Yeah,
throw that,
yeah.
yeah.
Yeah, but still under 350,000.
It's really sad. I mean, in my mind, it looks like a win-win for both parties. Are you saying it doesn't work out that
No, I'm
way?
saying you asked for the best deal. The best deal was the last one, last line. But that's the 810, that's a zero copay plan.
Empire Advantage with the zero office.
Correct.
So
And still give them the $100 reimbursement?
No,
Oh,
if you do,
there's no credit.
it would cost you 95,000 more to do the zero plan, okay?
Right.
However, if you don't give the $100 credit, you're getting about 70 of that back, so it's only a
Yeah,
25 difference.
But you still, what happened to the 500,000?
It's just,
Here's the man scorecard.
I'm just talking about,
just talking about the $100 business.
Okay, I know that.
The
We still got the
50
500 up there though,
The
right?
503,
We get reduced.
is at the 20, for the $25 plan. If you went to the zero plan,
Right.
it goes to 408.
408,
Okay.
If you don't give the $100,
credit that you're giving now.
then it goes to 478.
Right.
So instead of 503, it'd be roughly
478.
478.
Okay,
Yeah,
so
But that's still
we're
shared.
unorthodox
That's not all
accounting.
Right. But,
That's
not all
but a good portion of that.
Right.
is-
Right.
is the-
That's combined savings, county and Medicare property.
Okay. That's fine.
So I take it we're looking at the zero copay and not reimbursing them the $100. That's what's out on the table.
Right.
Yeah, Jeff?
Well, I'm just still a little confused. What are we actually doing? Are we looking out for county taxpayers, our current employees, or our retirees? You can't have all three, all right? We're in a budget year, you know, and I don't know, you know, look, retirees have to live too. Most are getting COLA increases. A lot of our county taxpayers are not. You know, I know that my insurance went up $75 a month this year. And the co-pays are up to a lot more than that. You know, we can't sustain this. We can't sustain raises. We can't sustain not cutting taxes. And when we have an opportunity to save $500,000 or $600,000, how can we not take it? And we have to, you know, I think we owe that to our current employees that are about to get the axe.
So what are you recommending? That it's the, stay at the $25 copay?
You've already did a pretty good job. You've cut down some, you know, you've saved some administration expenses by renegotiating contracts. I don't know exactly how much that's been. All right, you have an opportunity to save another $650,000. When you wind out of the trust fund, correct me if I'm wrong, I think there's another $600,000 or $650,000.
Yeah, but that, we can't talk about, that's not part of the Medicare Advantage plan consideration. So,
Yeah, and I want, the 503,000 is for the $25 office visit copay plan with no reimbursement.
It's just the $25 office visit plan, yeah.
With no credit.
It's whatever's in place now.
So, and that is county and Medicare beneficiary savings, so I'm not, I just want, we're not understanding the 6, 7. The biggest number on the table right now is 503, and that is shared savings. It's still a big number, but it's, I just wanted to, it's not 6, 7.
And that's with a $25 fine.
Yes.
So can you tell the supervisor what the actual savings is out of the 503 for the county?
I would have to calculate that, Rich. I mean, you know, it depends on.
That's
how
on
many
that
years-
350, 370, whatever
Something
that
in
county,
that ballpark.
whatever that county shares.
Still a
And that we
savings.
share.
As long as
Still,
some,
several
10 jobs,
hundred.
10 employees.
350,000 in my book only comes about 6 jobs.
So,
no, go ahead.
so basically what you're saying is that all well and said, everything that's done, okay, you're talking about by going on this Medicare Advantage, okay, that bottom line to the county is approximately $300,000 to $350,000. Approximate, unorthodox accounting, whatever, between $300,000 and $350,000.
Yeah, I would,
That's the bottom
$25
line,
copay, like,
I would say that's
So
reasonable.
the 25.
correct?
Yeah.
Okay.
Yes.
$25 copay.
Every year forward.
And I mean,
No, it's only 25, well, it depends on if you get the $100 credit. See, we're mixing,
I understand.
we're mixing things here.
Like I
Yeah.
said, I'm
Yeah.
saying the worst case.
yes, Michael.
I didn't have authority.
I'm done.
How is this implemented? Let's assume the resolution goes up and it's implemented and that's it. What is the procedure?
The procedure is Benetech will implement it. What we're trying to get to is which plan is the one that you want to move forward with if you're going to move forward with something. So is it the 25 and not the 100? Is it the 25 with the 100? Is it 0 with the 100, not with the 100? What is the final?
What, you want me to make one? I'd say 0 and no refund, no 100. No credit. We'll give them the 0.
Okay. Greg?
Yeah, I would say the same.
I like that too.
John? Huh? Brian? All right, so now we've got a plan, that the plan, whatever the plan is, we have to put into this resolution by amendment, next week. So we need to know that. Now we have,
Can I ask you one, are you gonna put this through the full board next week?
yeah.
Oh, okay.
We got a resolution on tonight, we just have to fill a blank some.
Needed a couple of amendments, a starting date and which plan. But then Michael's question is, how is it implemented? So I think that discussion was occurring, so I think one of you can address that.
the minimum time we really would want and need is 60 days for communications, for on-site meetings. Empire, there's Empire staff that does nothing but Medicare Advantage plans. They would assist us in those meetings, but there will be written communications as well as multiple opportunities for the retirees to come in, hear a presentation, get their questions answered, so that we're done by the first week in December, so there's still enough time, because it can be, we had some retirees come to the meeting 2 or 3 times. The communications challenges.
I mean, I'll add Barry that it's 60 days minimum, we prefer 90 to start October 1st.
So first of the year.
So first of the year.
Yeah, oh, yeah.
First of the year,
Yeah,
which is
first of
rough
the
good.
I think that's what Michael's after,
Yeah,
when we're actually
Yeah,
taking
because we're doing the budget.
Yeah, that's what
I'm sorry,
the rates were based on in January 8. So any savings, if you went a month or so later, you got to divide it by 12.
Okay, I got Butch and then I got Rich.
Okay, I just want to make it clear, okay, that with this 0 and no reimbursement, that it does not cost the retirees any more money, and they still save money. That's a fact.
That's a broad statement because
You
You
can't
can't
make
guarantee
prescription
that
drugs.
their
Because of prescription drugs
will be
and
a little bit
copays.
more.
If
They will save on what they pay to the county.
Right.
That money can be utilized for their drug co-pays that they may not have now. But if they're utilizing a lot, then those people may have additional costs. But there's gonna be some people that are gonna be saving money and aren't utilizing any of this.
But they're not gonna, but with the zero, they're not gonna have a copay.
For office visits.
Correct.
Right.
Okay.
On the office visit side, you're correct.
Before they did.
No, zero.
No.
They didn't have any
Well,
copay before either?
It depends.
Okay.
What's your
Is that-
Okay, hold on.
I wanna make sure,
But it's.
He doesn't read the stuff in front of him.
no.
Whether
Okay,
it's
what-
zero copay with no premium credit, no Part B credit, the husband and wife together would save $600 in premium contribution for the year.
All right.
Now, that will cover, that'll cover a lot, particularly with the zero office visit copay. There is drug utilization. But if someone doesn't use any meds, then it's $600 to the good. Some people are going to spend net a little bit more out of pocket depending on utilization.
Remember, we're not starting at 503 now, we're starting at 419.
That gets to be reduced.
Okay, Rich, was that?
No, the thing is, talking about risk assessment in 90 days. One of the concerns I had, and we talked about this before, is that retirees now, a lot of them are leaving to go to Florida and Arizona. So they won't be around for these meetings. So they're going to be sent letters in the mail, they'll be calling me up trying to explain the biggest cards. So it's kind of touchy. The other thing is, and we also discussed this, and I'll probably be gone if this happens anyway, it doesn't matter, but we tried this before. They didn't like it because of the co-pays. It was also, but it was a little different. They had a $25 co-pay plus the drug. But if you ever go back, remember, if you ever go back the other way again, it's really hard to get those cards reactivated. I'm just telling you. I went through it for 2 years. So hopefully the plan will last in 2000. My term ends 2015, so hopefully by then, if I go back, I'll be gone by then, so I don't have to get for all this stuff.
I would say that if you have the same, if it were to happen where you went out of the Medicare Advantage back to a commercial product, we want the same 90 days because CMS takes a couple of weeks to recognize that someone's moved out of a Medicare Advantage plan back into original Medicare. We tried to do this in the middle of December, 3 years from now, for January 1 date. Yes, people are going to have problems using their AB card on January 1st. If we start on October 1st with the transition, the problems with reactivating their AB cards should not exist. It's really a matter of time. So if you wind it down over a long enough period, you should be able to avoid most of those problems, if not all.
Okay, I got it. Chair?
I just want to make it really clear that by choosing the plan you're choosing, everybody understands you're not taking the biggest savings for the county. And we've been discussing this for quite a while, and you're skipping over the biggest savings for the county, and just to make that sure, that needs to be very, very clear. Because probably that's what's going to be in the paper. But we've been talking about this for quite a while to try to get the biggest savings. We're not, by taking that option, we're not doing that. Just make sure you understand that.
Okay, Chair?
Oh, yeah.
Jeff?
Yeah, it's $90,000 difference between those two there. This is the same thing that we were such a desperate straits back in January that we abolished some positions to save money. We cut one of our employees $15,000 a year. We tried to cut the budget officer to $10,000, and we're facing 35 layoffs and talking about devastating, Meals on Wheels and popular, the Office for the Aging and some of the outside agencies. I don't understand how we could just throw $90,000 away. I really don't. We have to take the options as the greatest savings for the county. And at this particular point, that hurts me to say that because I understand people are out there struggling. But
Well, there'll be an opportunity at the full board meeting for you to offer up an amendment and get that option passed if the support is there. But it's, you know, it's more or less, it's a democracy, it's a, you know, everybody has a vote, and so, John?
Okay. I understand where you're coming from to try to save that additional $90,000. However, you are affecting our group that has a fixed income.
My father included, just so you know.
My mother included. And my mother doesn't get a pension from New York State. My mother's strictly Social Security, so I understand, but the $25 office visit is something they don't currently have to pay. And I don't see where this $90,000 that we're leaving on the table here, as it were, is going to make the difference between us closing the doors and keeping the doors open here in Montgomery County. We're talking about over 200 people that would be affected by this. To me, $25 means that I don't buy coffee at Stewart's for a couple of weeks. But to them, it may be the difference between having something in their refrigerator or buying their meds. So that, I have no problem with leaving it at the zero office visit. I believe they will see an additional cost because of the $10 copay on the scripts. They're, at the end of the year, I don't believe they're going to save the $16.65 a month to $33.31, because we all know that our seniors are the ones that use the most scripts. So they're not going to experience a real savings, and I'm certainly not trying to have them experience a real cost either. Thank you, Chair.
Okay, thanks, John. Anyone else got any questions? Yeah, Bill.
Thank you, Chair. Speaking for myself, when we came into this meeting, we knew we were looking for savings along the insurance line, but I don't think it's fair to balance your budget or go for the greatest amount of savings on the backs of the seniors and have them suffer as a result of it. And I think what we've offered up here is possibly the best plan for both sides. That's how I feel about it anyhow. And
I think that's probably the consensus.
And there's still a savings.
I think that's a consensus. Okay, let's just jump. Do I have a sponsor for this resolution? That John, Bill? All right, it'll need an amendment, so you'll give me a plan number, and we'll have a startup date, and we'll offer up the amendment next week. All right? Okay, anything else on Medicare? Oh yeah, dates are already there. It's just a Medicare plan.
So who's responsible for that, John and?
John and Bill.
And this will be the entire?
They're going to give us the number next week. We'll fill in the blank on that. Could you stay for a few seconds while Mercer, especially we got Delta Dental coming. Okay. There's a resolution here I need a sponsor and a second for a resolution adopting Montgomery County health insurance policy regarding premium equivalent payments by employees. I'll sponsor that. Bill, second. All right. Rich, you want to explain it, or?
When we had that meeting with Daryl, the question was, well, we've had policies for years. No resolution, just a policy for since I've been here. And I went back and looked at I forgot the supervisor's name, 1958, an old policy, which has continued all these years, where we charge a premium to an employee, and the county is short money. We don't ask the employee for money to pay for that shortage of health insurance, which is the opposite. If we have money left over, we don't give the money back to the employee. we have nothing in resolution form that states that. So I'm doing here to try to clarify by resolution that I have something on file that states that way. That's the way it's always been done.
Does everybody understand that?
Darryl asked us to do that at a trust meeting.
That if we're offering up the premium equivalent, if the insurance costs are short, the county will pony up. If there's excesses, then we don't give it back to the employees. Okay, everybody understand it? John?
Thank you, Chair. Does this mean that we are actually going to formulate a resolution annually that will establish that number? Or are we just going to come together as a group and say, this is what it is, and pass that number out?
Well, this isn't to set the premium equivalent. This is the policy on,
Well, that's what I'm trying to get at. Does the policy require that the personnel director, in conjunction with the personnel committee, establish a resolution annually that comes before the board to go up or down to establish that premium equivalent? Or are we just going to come together as a committee and say, this is what the number is, and pass that number out without taking it to the full board?
no, I think the board of supervisors, based on recommendations from the insurance consultants, in which they've already done that, if we continue to go on,
Right.
that the board of supervisors sets the premium equivalents, because those are contractual obligations to the rest. So the board will have to set the premium equivalent.
That's my argument, is that it's somewhat vague here that the board of supervisors is the one that's establishing the number
Yeah, this is not supposed to be this one.
that is officially used. Well, I shouldn't say that the board of supervisors is establishing the number. The personnel committee and the personnel director will establish the number. And as you say, in conjunction probably with Benetech. But I think that it still needs the blessing of the board, and that is rather vague in this resolution, is what I'm getting at. It doesn't say here that it needs to come before the board for them to officially sanction what that premium equivalent will be.
Okay, that language should be that it's a recommendation to the board.
Correct.
Someone has to review annually whether the premium equivalents have covered. And so, go ahead, Rich.
Yeah, basically, because we do two equivalents now. One's going to be our self-insurance plan, which we get the rates from Benetech, from Darren, which is now we get to go through the rates and get that for self-insurance. The other is the premium rate from Blue Cross for the Medicare Advantage. So whatever rate they give us, Medicare Advantage, that's the rate.
Yeah, but
unless you want to go back and say it's too high, you want to get rid of Medicare Advantage and go another insurance company.
No, I think that what John is talking about is in our active population and the premium equivalent, setting those rates. Somebody has to review it, and so we'll make sure that the personnel committee and the personnel director and our consultants review the premium equivalents and recommend to the full board. So we'll modify that language for next week.
Because basically every November.
Make
Recommendation to the full board, correct.
Yes, it can be added right in there, make recommendation to the board of
Right, so-
supervisors to adjust the rates accordingly.
Correct.
Okay,
Annually.
and we'll take care of that. I got
Annually is already there, yeah.
Right.
okay. I
Simple
got Bill.
question, Chair, I was just wondering if that's something that can be done like in January of each year, or would it be?
It should be done prior to January.
Every November, we have, like, a orientation for all the employees. They don't know what the rates are.
Yeah.
So, and we also do it during budget process, so you don't actually budget yet. So normally, we tell the board in your budget process how much the insurance costs, how much is in the line item, how much it is, so it's all based on November normally.
That's even better.
Okay, Bill?
Thanks.
Butch?
How many times have we fallen short?
Well, how many times have we fallen short? No, the question gets to be is, what do we do as we're transferring from the trust back to the county?
Have you ever heard of an insurance company giving anybody a rebate?
No, but we don't have a
yeah.
but we're the insurance company.
That's what I'm saying, so why would you want to give it back? I don't understand it.
Well, because we need to establish a policy on it.
So we have a policy, we need a resolution. resolution to make sure that policy keeps on going.
If we have overpaid, well, what happens is that if, on their analysis now, that if you don't amend your rates now, you will be 1% short
For the active population.
for the active population. That's in their literature, that what they just handed out.
Okay, so we do the rates every year.
We have not done the rates because we have not handled
Well, I
this.
trust it before, but I'm saying the rates were given and modified every year.
But not by us.
No, I know that.
So
But
we
I'm
have
saying
to
we're gonna continue to modify the rates every year,
annually.
annually. But if we did, let's say we didn't have to,
Wait, here's the problem. Here's the
I
problem.
don't wanna get into a situation, I'm gonna make this very simple. I don't wanna give anybody a rebate.
I agree.
Okay.
But you gotta understand
This resolution
here.
doesn't do that.
Huh?
Pardon?
This resolution does not give a rebate.
No, it doesn't get a rebate. But what it does is it protects the county from having to give them back.
Didn't you say that you wanted to give a rebate?
No, I
If we
said,
went
No.
over?
we don't want to give a rebate.
Okay, thank you. Okay. All right.
Yeah.
Never mind, forget it.
Because here's the problem. On the county's,
Painkiller.
on a legal side,
Painkiller.
on a legal side, which the insurance,
Seniors will have.
the M fund, where the insurance is gonna be, can't carry a reserve. That means that you would have to be very accurate, that you made sure that your premium equivalent just covered your costs, because you can't carry a reserve by law. So what you need is this policy in place so that if it's short, you know what I mean, you're not going back to the employees, and if you're over, you know what I mean, you're going to use it in the following year.
Kind of like a fund balance, right? You're using it to offset.
Basically.
I got you.
Okay, so I got a sponsor and a second on this one? Okay. I got a sponsor and a second. I sponsored, and John seconded.
No, Bill Strebe.
Bill Strebe. Okay. What's the pleasure of the committee? Move it? Okay. Yeah, Butch.
I thought we were on another resolution.
Okay, now we got a resolution authorizing the chairman of the board to execute an agreement with Delta Dental. All right, John, that's sponsored, and Greg. In transferring, no, the trust gave the 90-day notification to Delta Dental that effective 12/31, the trust will no longer be doing business with Delta Dental. That means that the county, because it's a contractual obligation, is required to provide dental to our employees. All right. So what Benetech did is renegotiate the contract with Delta Dental, and you have it there in front of you. Those are the white sheets. The difference between the trust and coming back to the county is that with the trust we were paying, if you look on the second page where it says administrative retention fee, we were paying $8.30 per employee per month. We are now paying, with this contract, $4.45 per contract per month, per employee. Okay? So any questions on this while they're there? If not, what's the pleasure of the committee? Move it?
Move it.
Okay. You got anything left?
You gonna bring the matrix up or not?
I don't know.
Somebody did something I didn't, he should have been here.
Myself.
All right, last, yeah, we're not going to do anything else? If not, is there a motion to adjourn?
Well, where's our attorney?
Where's that one?
Our attorney.
I don't know. We told them last week that.
He was supposed to be here tonight.
Yeah,
I had no notice that he wasn't.
yeah.
Motion to adjourn.
Motion to adjourn is a second. Bill, all in favor? Aye. Opposed?
Great, man. Great sound.
Did somebody talk to you?
Last week, yeah. Last week, yeah. Not this week. He was supposed to be here tonight. It was all set up that he'd be here tonight. I haven't heard anything else. I haven't heard one thing in any
Told to be here.
Yeah.
Tell him 6.
Even if he was just gonna be here at 70.
Yeah, that's right. Told him to be here at 7.
They're probably going to ask for these nights.
I don't know what's going on.
It's 4:10. Probably mid-October. It was probably early this year. Yeah, I actually.
Well, it's not good.
I think okay.
Call them all.
Yeah,
Just give him $4 grand. What was that? I'm gonna come back. What was that on the audits for him just now? Was it $4 grand or $5 grand? We might have to check that off this month.
You missed a lot. Dominic can be here.
Was he in rare form today?
And then they were talking right, between the 20 days.
Somewhere along there, because then they were talking about combining that with the meeting. Candidates. So I don't know when.
I'll second it.
Dominic said he was going to get together tomorrow, I think he said by the end of the week, I said when he'd have another meeting.
I know it's like.
Meeting right now.
I am.
Because it was dated 8/13, which was Thursday.
We haven't figured it out.
I was wondering if anything is going on between Tuesday and Thursday. I have it down. Rich was all right with me that way.
Yeah, that works.
Yeah.
I second it. I second the motion. Well, I don't know.
Waiting for all the members to. The agreements, we're gonna have another meeting, a special meeting. Call the finance committee meeting to order, please. Privilege of the chair. As you all know, you got the notice last week that we're gonna have a budget workshop again tomorrow afternoon, 3 o'clock, room 214. Your attendance would be greatly appreciated. Bring your scissors with you. Does anybody have anything they wish to discuss before we get into the resolutions? Hearing none. First up's a resolution amending 2012 operating budget, CHIPS fund. We have a sponsor. We need a second for Allen. Discussion. Paul's here. Obviously, he can explain it if you need it explained. Go ahead.
Okay. The CHIPS is a reimbursable. You have to spend the money before you can get the money back. So in my budget every year, I always put in the same dollar amount that I got this year. I put in next year as what the anticipated amounts are going to be. Because of the flooding and things like that last year, we had a carryover balance last year. $548,000. So in order for Sean to be able to transfer it into the capital budget for me to spend it, it needs to appear in my operating budget, and that's what this resolution does. It shows up in the 2 spots. It needs to be in my operating budget so he can transfer it into the capital budget so I can actually spend it.
Yeah, you get it then.
And then, once I spend it, then I can request reimbursement from the state to get it back.
Question?
Move it.
Move it? Opposed? Next resolution is a resolution amending 2012 operating budget, equipment, public works. We have a sponsor, we need a second. Shane?
Move it.
Supervisor Greco's in a hurry all of a sudden.
Painkillers are wearing off. His painkillers are wearing off.
Yeah, we do now.
We need a lot more.
Wishes the committee to move
This
it?
is actually a sewage pump for this building that he basically.
Right,
Okay.
Move it.
and we know what he's doing.
Yeah.
All right, next up is a resolution amending 2012 operating budget, New York State Office of Homeland Security, 2012 grant, emergency management. We have a sponsor, we need a second. Supervisor Chiara. Discussion? Wishes of the committee, move it.
Chair, can I ask a question?
Go right ahead.
I'm not on your committee, but I was wondering, it's probably a question for Shane more than anything. Did FEMA come through on the project, the flood project in your town?
Oh, the county part?
Yeah.
The additional?
I was just wondering if they ever came.
Oh, we haven't got any farther with that, because the county hasn't signed, neither has the state.
We did,
Did
the
they
county
send those?
did receive a check for an excess of $425.
But what about the additional, the other half of it that they cut?
I'm in the process now of appealing
Right.
for the additional.
Neither SEMO nor the county signed the PW when they changed that dollar amount. So the SEMO was also fighting it
This is for the village.
for the hamlet, for the
That
county
got
portion, the county portion.
Large project. We have received payment, and I don't remember the exact dollar. amount.
432?
Around $425,000.
I think it was 432, wasn't it, or right close to that? Somewhere between those two numbers, 4 1/4, 432. Out of 6
total
something.
was a lot more than that.
Six.
It was around
30.
36,
Yeah.
20 something, almost 30.
With the additional 100,000 that was tacked on? Okay, thanks.
You're welcome. Anything else? Wishes of the committee?
Move it.
Move it. Next up, resolution approving abstract of audited claims. Board of Supervisors have a sponsor. We need a second. Supervisor Sweet.
Move it.
Move it.
Yep.
Move it.
Opposed? Just making sure. Next up, resolution amending 2012 operating budget post-closure agreement, MOSA. Unfortunately, this snuck through and had my name put on it. I need to take my name off of there.
I'll pick it up.
Supervisor Walters will sponsor it. Do we have a second? Supervisor Chiara. You're hiding over there. Obviously, this is for the shortfall because of the tonnage that isn't delivered to MOSA. So it's not paid for through the tip fee method, and we're on the hook for those monies that aren't paid for on the tip fee method. Wishes of the committee? Move it. Opposed? And this last one is an add-on. Is a resolution authorizing chairman to sign agreement, Corning Data IBM mainframe backup computer leasing. That's data processing. We have a sponsor. We need a second. Supervisor Rico. Apparently the numbers that he got were not as good as what he was hoping for.
The vendor missed one.
And that's why you have a different number on this.
Under, like that.
The vendor missed it.
Right?
Yes.
Mine stops at the post-closure agreement.
That's why I say it's an add-on. Apparently the add-ons didn't get handed out.
They're electronically.
It's a real add-on, it's not on the
I'm reading it.
Yeah, we don't all have those.
We can make that happen.
Well, not to me or not. I like good old-fashioned paper.
I'm sorry, I didn't realize you didn't all have a copy of that. So that's what it is. That last month, we had a resolution that came through for $76,000 for the 3-year agreement with IBM. That was a reduction, I believe, from somewhere around 120,000 or more, down to 76. Well, apparently the vendor didn't give Dan Cologne a real good number. It's actually 84,000 instead of 76. So we need to come up with the extra $8,000.
2,600 difference per year. Over the 3 years.
And that's what this add-on resolution was for. And he just got notification, that's why it's an add-on. We didn't have it officially.
I'll second that.
Move it?
Yep.
Anything else?
Yeah, real quick. I don't know how many people know this, but even though it's raining like today, we're still under a water problem, and we've been trying to get pumps from SEMO for a couple of dairy farms. There's a couple of dairy farms that are pumping 40 to 50,000 gallons of water a day, and they're out. SEMO has refused the pumps. Montgomery County has used these pumps before. They're high-volume water pumps with their water pipes and everything. They're sitting on trailers over at the state parking lot, apparently in Albany, and they flat out denied this. Dwight has been trying to get these pumps released. Corey came to me on Sunday and asked me Sunday about what they could do. Dwight is looking to do a teleconference between SEMO, Ag Markets, Soil and Water, and the county. But Corey thought maybe that we need a letter from the county also asking this and put more pressure on SEMO, because these pumps have been given out for private use before. Now they're taking the stance that the pumps can only go for public use, so they can't be used for any dairy farmers. But they've been pumping water out. They pump out of the Mohawk, they pump out of the Schoharie. There's a couple of ponds. I think Keller's is pumping from a pond pretty far away. But they're getting pretty desperate. Even with this rain today, it's not going to make a difference. You think about 40 to 50,000 gallons a day per farm. It's a lot of water they're using. So we need, what I was actually just going to ask everybody if it's okay if we send a letter right from the Board of Supervisors to put pressure on it to ask for these pumps, that we're in dire need of these pumps.
If it does any good, do it.
Yeah, if it does anything, I don't know if it's more than just throwing stones at a brick wall, but whatever.
Call your representatives too.
Yeah, that wouldn't hurt.
What are they for?
It's election time.
Anything else? Motion to adjourn? Supervisor Kara, Supervisor Snake.